the Children's Hospital, the Schneider Children's Hospital, and the other two adult hospitals. And we are working there. Ophthalmologists in Israel, we are about 680 ophthalmologists. Among them, 1/3 are working at the hospitals and other in the community. And most of the ophthalmologists who are working in the hospital are subspecialists. They trained in, most of them in the United States, but some of them in Europe. And as you see this small organ, we have about how many? About 10 subspecialties for those who are not ophthalmologists here. The main target of Israel ophthalmology, first of all, is public health, of course. And then the preventive medicine. We are doing many projects in Israel of preventing medicine. We have mobile eye units to prevent diabetic retinopathy or to detect the patient with diabetic retinopathy, age-related macular degeneration, and glaucoma. We have a big support to the third world countries. And of course, as you heard, we have some research programs. The ophthalmology in Israel is a primary ophthalmology by general ophthalmologists in the community, secondary subspecialty either in the community or in the hospitals, and tertiary surgery and admission, which is very low in Israel, the admission because of eye diseases. Our help, our support of the third world country, these are the missions that I myself participated in, and one before the Ethiopia was in Marshall Island in Micronesia. These are not, these are the islands. I don't know how many of you visited Micronesian Marshall Island, but we support these people there. In the third world, half of the problems are cataract, of course, a disease that we can cure within 10 or 15 minutes of surgery. Others are glaucoma, corneal opacity, and glaucoma, and so forth. You see, these children, this small one, has a glaucoma for 5 years, congenital glaucoma. He was born with a glaucoma, and for 5 years, one eye is blind, and the other I operated upon when I arrived there. In the sub-Saharan Africa, there are only one ophthalmologist per one ophthalmologist per million people, and as you saw, we have 680 ophthalmologists in Israel for 7 million people, and yeah, so we are 75% of blindness or the blindness in the third world country is preventable, and but the main problem that only per year only less than 250 cataract surgery are done, and we are in 3 days we perform 110 operations, so half of the yearly amount. The last mission was 2 weeks ago. 3 weeks ago, I came back from Ethiopia. We flew out to Gundar. Gundar is the place where all the Israeli Jews, all the Ethiopian Jews were gathering together there. When they came to Israel, now in Gundar, they are the Falashmura. I don't know if you heard about the Falashmura. These people are converted Jews, and we operated there. You see what we found there. Here, this is the examining method with the magnifying lenses and a flashlight of the iPhone. You know, there is an application of flashlight with the iPhone, and this is the true outpatient clinic. In the first day, we examined 450 patients, and we had decided who is going to be operated. Then we sent them to Gundar. This is, you know, this is the way to the hospital of blind people. Look what how many stairs, and these are the patients. They came from the village, and they are waiting for us, the hospital, and this is the operating room. You see, after the injection to the eye, this method is to spread the anesthetic drug behind the eye, and then you see the operating room, 3 operations in the same room. And what you see on your left is the sterilization technique. You put it on the gas. Yeah, why we can do it? Because ophthalmology nowadays, for those who are not ophthalmologists, is daycare with no admission, short operations, local anesthesia, minimally invasive, and very fast recovery. In Israel, we are very, very advanced in these methods. We have all the vitreoretinal. We have the machines. Then we have the vitreoretinal operations, combined cataract. We combine operations all together. The patients are not admitted; they are going home after the operation. And I want to talk about small, some research project that I am involved in. The CEO of this company, Non-Retina, we are developing an ultra small device that is to implant. You ask how many companies are involved in this project of the bionic eye, or what you call artificial retina. So we developed an ultra small, easy to implant artificial retina designed to restore vision. We implant the device within the eye. You know, this is the place where we implant the device in the center of the vision. You see there are no blood vessels there. We call it foveal avascular zone. And this is the human retina. This is the place, and the optic nerve here. We implant the device here in the center of the eye, the retina. We don't use any camera to capture the light, the image. As the other companies, we try to use the normal, what we call the normal optic nerve and the cortical vision, and we choose as an animal model a pig, and this is one of the operations that I did. You see why we choose the pig? Because the retina is similar, almost similar. There are many other things that the pig is similar to the human being. But you see the retina here and the structure of the retina, the histological structure of the retina. In the surgical procedure, first of all, I take out the lens, then I implant the chip and replace it and place it in proper position, and then implant the lens. And this is in vivo, replacing the chip, placing the chip in the center of the vision. What is the device? The device is on one side the optical capture particles, and then the other are small electrodes. You see, this is the size of the implant is 3 by 4, almost is a silicone on glass, and 600 electrodes in this length. It goes straight to the middle of the retina, and you see post implantation. You see that we have retinal tissue on these stitches, on these pins, and this is the eye of an animal that was implanted 2 months ago, and the animal is alive, and you see that the chip, the device is steady in the retina. About functionality, we don't know yet what will happen, and these are, of course, what we shall see what will be in the next couple of years. So you see, small company, Israeli company, are developing some, are staying in the center of the heart of the research in blind patient, for blind patient. Thank you.